Acute hepatitis is the inflammation of the liver. When the liver cells become inflamed, this can cause the cells to die, creating scar tissue. A buildup of scar tissue within the liver can lead to fibrosis or cirrhosis of the liver, resulting in dysfunction of that organ. Inflammation of the liver cells can be caused by a variety of reasons. One of the first reasons is through autoimmune diseases. With autoimmune diseases, the immune system will attack different parts of the body. So if the liver has been attacked, that's how the damage to the liver cells is occurring. One of the next reasons is through substances. Substances such as alcohol, medications, or drugs can cause a buildup of toxic chemicals within the liver, resulting in damage of the liver cells. Neither of these types of hepatitis are contagious. However, it's important to note, with substances, IV drugs are the leading cause of viral hepatitis. Viral hepatitis is contagious and causes damage to the liver through direct action of the virus, meaning the infection itself. With hepatitis B, this causes damage through cell-mediated immune response, meaning that instead of the body making antibodies toward the virus, it will kill off the infected cells. With acute hepatitis, if the damage was not too severe, the liver cells will be able to regenerate themselves and resume normal function. On the other hand, even an acute attack can cause damage that's too severe for repair. This damage is now irreversible and can lead to liver failure or death. So I kind of went over how autoimmune and substance hepatitis occur. For viral hepatitis, since it is contagious, it can be contracted in a few different ways. There's also 5 different strands of viral hepatitis. There's A, B, C, D, and E. Hepatitis A is a self-limiting disease, meaning that it is acute and it will likely not become chronic. It's mostly contracted through contamination, which occurs the oral-fecal route, and the virus can actually stay live inside of feces for up to 2 weeks. Common places that this occurs is daycares, prisons, or through food, and that's due to the poor sanitation in these areas. Hepatitis A can also be passed through IV drugs or sexually transmitted. There is a vaccine, though, for hepatitis A, which makes it less common. Hepatitis B can become chronic, but most instances will resolve on their own. It's passed on through blood products, IV drugs, sexual transmission, or from a positive mother to the fetus. Transmission during pregnancy is more likely if the mother is also HIV positive. There also is a vaccine for hepatitis B, which makes that less common as well. Hepatitis C is also passed through blood products, IV drugs, sexual transmission, and from a positive mother to the fetus. Same with hepatitis C, it's also more common for the mother to pass to the fetus if she's also HIV positive. There's no vaccine for hepatitis C, and most instances will become chronic. There's also a 15 to 20-year dormant phase for this strand, which means that the person that's infected will likely not know that they're infected, and progressive damage to their liver is already happening without them knowing. Hepatitis D needs hepatitis B to survive. It can't survive on its own, meaning these 2 strands need to be contracted together, or the person will need to contract B first and then D in order for D to survive. The transmission with hepatitis D is the same as B, which is through blood products, IV drugs, or sexual transmission. The main difference with these 2 is one, that D cannot survive on its own, and D can also become chronic. For hepatitis E, it's not common in the US. It's more common in Asia, India, Africa, and Mexico. This transmission is through contaminated food and water. And the instances of hepatitis E in the US is from people who have traveled to the areas where the virus is common.
Manifestations of acute hepatitis include flu-like symptoms, nausea, vomiting, constipation, diarrhea, anorexia, rash, fatigue, right upper quadrant pain or tenderness caused by liver inflammation, a loss of the sense of smell or distaste for previously enjoyed foods, is common in non-smokers, and a distaste for cigarettes is common in smokers. Jaundice is a common manifestation of acute hepatitis. Jaundice is a yellowing of the skin and eyes and occurs as a result of disrupted bilirubin metabolism or the flow of bile into the duct systems of the liver. Along with jaundice, this disruption may cause dark urine or clay-colored stools caused by excess bilirubin deposits. Pruritus can be a co-manifestation with jaundice caused by bile salts gathering under the skin. This is an intense general itching that can be distressing for the patient. Important to note is the fact that some patients show no sign or symptoms at all and never know they have hepatitis. Also note that the disappearance of jaundice does not mean that the patient has recovered.
The only way to confidently distinguish one type of viral hepatitis from another is to test the patient's blood for the presence of the specific antibody or antigen associated with that viral hepatitis. For example, upon testing, the presence of anti-HAV immunoglobulin IgM would indicate an acute infection of viral hepatitis A. The presence of hepatitis B surface antigens upon testing a patient's blood would indicate an active viral hepatitis B infection. In some types of viral hepatitis, the blood can be tested for the viral load as well. It is important to know that in the case of hepatitis C virus, a false positive HCV antibody is possible and can result with a negative test, and that's because it can take several weeks for hep C antibodies to develop. If acute viral hepatitis is present, liver function tests would also show significant abnormalities. This includes testing for markers like aminotransferases like AST and ALT and bilirubin, which increase during an acute infection.
There is no specific treatment for acute viral hepatitis. General treatments that may be implemented for acute hepatitis include nutritional therapy and bed rest. Nutritional therapy focuses on a well-balanced diet with high caloric intake as well as vitamin supplementation to address the weight loss and anorexia that occurs with acute hepatitis. Another nutritional therapy component for acute hepatitis is encouraging that the patient abstain from drugs and alcohol in order to limit the detoxification needs of the liver. Bed rest is an essential treatment for acute hepatitis in that it encourages liver cell regeneration and decreases the demands on the liver. Medications for acute hepatitis depend on the type of hepatitis and severity of the infection. Currently, there is no drug therapy targeted at acute hepatitis A infections. Acute hepatitis B infections may be treated by drug therapy if the infection is severe enough to cause liver failure. Drug therapy for acute hepatitis C includes direct-acting antivirals for the infection, as well as antihistamines for pruritus symptoms and antiemetics for nausea.
Nursing diagnoses for acute hepatitis include constipation related to decrease in dietary intake, which is evidenced by a change in bowel pattern. Activity intolerance, which is related to infection and evidenced by general weakness. Fatigue, related to infectious process, as evidenced by decrease in the ability to perform ADLs. And imbalanced nutrition, less than body requirements, related to anorexia, as evidenced by body weight 20% or more below ideal weight range.
Hello, my name is Rebecca, and I am presenting the potential complications that can occur with acute hepatitis. The first complication that may occur with acute hepatitis is acute liver failure, also known as fulminant hepatic failure. This is a serious condition with a poor prognosis. Manifestations are encephalopathy, gastrointestinal bleeding, disseminated intravascular coagulation, fever with leukocytosis, oliguria, azotemia, ascites, edema, hypotension, respiratory failure, hypoglycemia, bacterial infections, and thrombocytopenia. Liver transplant is the only cure. prevention consists of monitoring liver enzymes. The liver enzymes are AST and ALT that are often elevated. The second potential complication would be chronic hepatitis, and this is the progression following acute hepatitis. It is manifested with elevated ALT, AST, ascites, lower extremity edema, asterixis, fatigue, hepatic encephalopathy, pulmonary arrhythmia. Prevention would consist of treating the acute hepatitis in a timely manner, and prevention of the first acute and chronic hepatitis would possibly be done with hepatitis A and B vaccines, which hepatitis B tends to progress more to a chronic state. The third potential complication is cirrhosis, and this is end stage of liver disease caused by excessive damage to liver and replacement of liver tissue by fibrosis and regenerative nodules. This is caused by the liver trying to regenerate itself. It regenerates with fibrosis. This fibrosis does not allow the liver to function the way the hepatocytes functioned before. So this in turn creates further complications for the liver and for the body as a whole. Hepatic encephalopathy, portal hypertension, and ascites, esophageal and gastric varices occur from the complications of cirrhosis. Hepatic encephalopathy is a potential life-threatening spectrum of neurologic, psychiatric, and motor disturbances that happen because the liver is unable to remove toxins, especially ammonia. Ammonia crosses the blood-brain barrier, causing the neurologic, psychiatric, and motor disturbances. Portal hypertension is an increase of venous pressure in the portal circulation of the liver. The body tries to reduce this pressure by forming other circulatory pathways, but these pathways give rise to esophageal and gastric varices. These varices have a tendency to cause rupture and cause a hemorrhage, which is a really bad complication, and this needs to be treated in a timely manner to prevent death from a massive hemorrhage. The last complication is hepatocellular carcinoma, which is liver cancer. Liver cancer that starts obviously in the liver and is the fifth most common cancer and the second most common cause of cancer death in the United States. Surveillance programs for those with chronic hepatitis or cirrhosis can help, but will not prevent it.